As a new Congress and administration turn their attention to health care, more and more groups are publicly voicing their support for the patient-centered medical home, the team-based model of health care proven to deliver the right care at the right time, at the right cost, and in the right setting. For the private sector, struggling to survive skyrocketing healthcare costs and an economy in recession, implementing the patient-centered medical home has become a matter of extreme urgency.
I think the private sector has to actually be the leaders of implementing the reforms that we need.
We'll be out of business well before government made the kinds of changes in health care that would fundamentally transform the system. We have to do that today because we compete today with tenacious, ferocious competitors who don't have the same kinds of health care, health benefits, costs built into the price that they deliver to the customers that we compete with on a day-in, day-out basis. So this was a matter of great urgency, fundamental to the ability of private employers to continue to be in business.
I mean, we literally lose a 747 load of people every day just because we don't have integrated care available to buy for our employees.
Large employers who have a lot of lives can have a lot of sway with healthcare companies and bring forward these new concepts in terms of the healthcare delivery system. I think that also the government through Medicare can do the same thing, and hopefully both will work towards the concept of the medical home as a way of increasing the efficiency of our medical delivery systems.
The patient-centered medical home has been endorsed by every primary care organization and the AMA, patient groups, numerous large employers, and the health insurance industry. Representing millions of Americans, these groups are working individually and in partnerships with physician practices and state governments on medical home pilot and demonstration projects across the country.
What we wanted was more value for the spend that we were making and that other people were making, and the path to get that was to make sure Mrs. Jones stayed as healthy as she could, and we did that efficiently.
Within 1 year, we paid back not only all of that upfront investment, but we made money on top of that. So it truly was a win-win-win. The practices were paid more, the health plans saved more than they paid, and the consumers got a lot better care.
Employers are very supportive, but they're all worried about costs, and we have an obligation to demonstrate that this not just feels good, but it is good, that we can show hard outcomes, that we're making a difference.
Instead of paying a per member per month fee the way that many of the pilots have been structured, they agreed to pay a portion of the cost of operating a patient-centered medical home. The governor's office put out the number, the insurance companies committed to do it. That was a very important breakthrough because insurance companies can't sit and talk together about how much to pay doctors. That's an antitrust problem. They're not allowed to do that, even if their intentions, as they were in this case, were excellent in trying to increase primary care reimbursement to create extra capacity in primary care. They still couldn't have sat down and all agreed on a strategy for doing that. So the governor's office was very important in getting this off the ground.
Medical home pilot projects are proving that when there's collaboration between all stakeholders, purchasers of healthcare, physicians, and patients, the patient-centered medical home fulfills its promise of better access and better outcomes at a lower cost. The Patient-Centered Primary Care Collaborative is an organization that brings all these stakeholders together to exchange ideas and is a leading advocate for the medical home as a central element of healthcare reform in America.
The Patient-Centered Primary Care Collaborative is a coalition or collaborative of other organizations as well as large employers and all of the primary care organizations. The National Business Group on Health is an organization of 305 large companies. They've signed on. We have the National Business Coalition on Health, which is a coalition of large and small employers throughout the country, and they've signed on. So they're part of the Patient-Centered Primary Care Collaborative, which represents some large employers and lots of small employers. And independently, we have about 120 or 130 organizations that have actually signed on to the Patient-Centered Primary Care Collaborative. Companies like IBM, Walmart, Microsoft, British Petroleum.
Another strong advocate of the patient-centered medical home is the Center for Health Transformation, a collaborative of private and public sector leaders founded by former House Speaker Newt Gingrich.
We're very big advocates of having a medical home in which you have somebody who knows about you as a person and who is involved in maximizing your health and helping you manage those chronic conditions that are increasingly a key part of our health circumstance.
With economists predicting a record budget deficit and increased job losses, the task of providing affordable, quality health care for all Americans may be more difficult than ever. One proven solution is the patient-centered medical home. Many feel it's the only solution we have. Ask your doctor about the patient-centered medical home.